And I think that in hindsight, yes, I think people could act faster, and maybe in the future we will take different decisions, and that remains to be looked at in lessons learned.
That's Dr. Theresa Tam, Canada's Chief Medical Officer of Health, admitting that, yeah, maybe we could have closed the border earlier. Maybe that would have worked. Funny enough, back when people like myself were saying this is what needed to be done, Dr. Tam was giving the opposite advice to the government of the day, and also chastising those of us who said border controls or border screening might work. She was more worried about us making sure that we went out to Chinese restaurants than she was making sure that Canadians stayed safe. That was back at the end of January. Now, well, she is admitting to the House of Commons virtual meeting of the Health Committee that, yeah, we could have acted sooner and it might have helped.
And I think that in hindsight, yes, I think people could act faster, and maybe in the future we will take different decisions, and that remains to be looked at in lessons learned.
But Tam can't actually just admit that she was wrong. She also wants to say that, well, there are other measures that we've taken, such as putting people into quarantine for 14 days that have helped slow down the spread of coronavirus or COVID-19 here in Canada.
Some of the really key measures we've put in isn't necessarily just closing the border and reducing the numbers. It's also asking people to take the 14-day quarantine measures. So I think that is essentially the cornerstone of what we need to do going forwards.
Yet even that is something that she wasn't pushing for in the early days. It was a suggestion that you might want to go home and self-isolate for 14 days. Other countries took stronger, stricter measures. Other countries decided not to listen to the World Health Organization. They had strict measures at the border. They told people to stay home as much as they could. They told people to wear masks in public, something that Tam is now advocating for after telling us for months it wouldn't work.
So our advice right now is there is no need to use a mask for well people.
Time and again, this woman has been wrong, and that's why I say that Dr. Theresa Tam needs to be fired. She has been the chief advisor to the Trudeau government throughout this pandemic, and she has given bad advice. I would add to this that other chief medical officers of health have given bad advice, such as Ontario's Dr. David Williams, and he should be gone as well. I can't speak for all the other provinces, but time and again, these officials steered governments in the wrong direction, and that led to some bad decisions. Too many times we've seen governments say that they're going to listen to whatever the chief medical officer of health has said. And yet, where has Tam been right? She was wrong on closing borders. She was wrong on border restrictions. She was wrong on wearing masks. And she was more concerned about making sure that we were not stigmatizing groups of people. Look, when I started calling for border restrictions, I wanted them in place because Wuhan, China was the hotspot at the time. As it moved to Iran, I felt the same way about flights from Iran or from Egypt or from Germany and then the United States. By the way, she is now advocating for keeping the border closed because while previously closing the border was a bad idea, now it's going to keep us all safe. This is not a woman who's basing her decisions on science. She may say that, and she may say that the science is evolving, and I admit that this is a difficult pandemic. But compare Canada's mortality rate, our deaths per 100,000, which sit just over 16 at the moment, according to Johns Hopkins University. Compare that to countries that didn't follow the path set out by Dr. Tam and the WHO, places such as Taiwan, Japan, Australia, New Zealand, all of which are below 1 death per 100,000 of population. That is the measure that counts, not how many people contract the virus, not how many people might even be hospitalized, but how many people died from this virus. And in Canada, yes, we're doing better than the United States, which, surprising to many people, is doing better than much of Europe, but we're not doing as well as we could have had we had better advice. Dr. Tam's main job was to prepare us for events like this. And whether it was giving bad advice to the government, spending more on climate change storytelling than her department did on personal protective equipment last year, it doesn't matter. She has failed at her job and she has to go. We should hold Justin Trudeau and his cabinet to account for this as well, but we can't do that until the next election. But in the meantime, we can tell Dr. Tam, thank you for your service, but you have failed us and it's time to move on.